There's a new disease amongst us that has no cure or control. It has been estimated that over 30 million Americans currently have this disease, and only 16 million of which have been diagnosed with it. It is the fourth leading cause of death in America, and this hitting killer is expected to become the third killer in the United States by the year 2020. It has been discovered that it is decreasing in men, but it is increasing in women. So what is this disease that lurks among us today? It is called chronic obstructive pulmonary disease, also known as COPD. COPD has recently been rediscovered, but has always been known. The discovery of COPD began in the late 1960s. However, the research of COPD began to develop in the early 1990s. This disease does not attack the system right away. It is a slow, progressive disease causing the exchange of carbon dioxide to oxygen to decrease. COPD mainly targets are 95% of daily tobacco smokers. 5% are exposed to secondhand smoke or an environment with heavy count of deaths or fumes. And less than 2% are actually genetic. People exposed to COPD are mainly people above their 40s and are heavy smokers.
COPD is a combination of chronic bronchitis and emphysema. Chronic bronchitis is a long-lasting cough with an increase in mucus production. The buildup in the cilia narrows the airways and leads to a raise in bacteria, infection, and mucus production, caused by the wet and clammy environment of the lungs. Now, emphysema is the harm of the walls on the alveoli, decreasing the number of air sacs. The decrease in air sacs cannot transfer oxygen into the bloodstream consistently and easier.
This can be seen as part of a balloon that has been blown up way too many times. As time goes by, it begins to lose its elasticity, making the balloon bigger. Just like the lungs, it begins to expand in size. This is known as hyperinflation, making the lungs perform at a lower efficiency than normal lungs. The combination of emphysema and chronic bronchitis results in the cause of COPD. Some of the known symptoms of COPD are an increase in mucus, increase in shortness of breath, confusion or forgetfulness, feeling ill, severe fatigue, and even ankle swelling. These are some of the main symptoms that are related to COPD. Some of the mild cases of COPD may be a person just experiencing an increase in cough, but the most severe cases may be a man having trouble walking 10 feet and must sit down. Now, there are no known cures for COPD, and there is no sophisticated way to prevent it either. The current known treatments of COPD are the same treatments used for asthma patients. Depending on the severity of the case, patients mainly use inhalers. The treatments are only used for temporary relief. Inhalers are used to help clear and open the airways of the lungs. Another form of controlling the symptoms is by antibiotics. They are primarily used to ward off infection and bacteria caused by COPD. Steroids are used to alleviate the inflation of the lungs caused by COPD. Unfortunately, there has been no medicine found to help to relieve symptoms of COPD. People with a severe case of COPD will most likely turn to oxygen therapy. This will increase their survival rate. But the number one way to help reduce the symptoms of COPD is to stop smoking them cigarettes. Simple as that. Even though there is no cure for COPD or no suitable treatment designated to COPD, clinical researchers are finding the ways to better understand it and stop COPD. Currently, UCSD Medical Center is one of the 21 research facilities attempting to gain further knowledge on COPD. UCSD has conducted over 5 studies on COPD, ranging from better treatments to further knowledge on the disease. The study that is now currently enrolling is one of the largest COPD studies ever done. This 2-year study is called COPD Gene, and is finding genetic causes that make some smokers more likely to develop COPD than others. COPD is a main killer for many, and the results of clinical research will help us to prevent and stop the increase in COPD. With help from people from the community to participate in studies, clinical research and the gain of knowledge for medicine will be endless. Now, my medical interns, I want to say thank you to you. I hope you learned a lot on today's episode.